Hi, my name's Simon Curtis. I'm a GP based in Oxford, and I've been a GP since 1994, so coming up to nearly 30 years now. Absolutely love it. Went into general practice after floundering around in various different medical specialities, and then really found my niche in GP land. So the first thing I'd like to say is congratulations for choosing general practice as a career. It is the fascinating interface between medical science, medical research, and humanity and people. And that's what makes it such an endlessly fascinating and also at times challenging, but always interesting and always rewarding job and a career to do. Rachel's asked me to give you a top tip for a happy and successful career in general practice, and I just could not whittle it down to one. So what I've done is actually come up with my top 5 things that I'd wished I'd known when I started off in general practice. The first thing that I wished I'd known was that it's possible to be nice and efficient. When I first started in general practice, I really wanted all my patients to like me. I wanted to be really nice to all my patients. I wanted to give them loads of time. The consequence of that was that my clinics just run later and later and later. Patients were waiting longer and longer. That meant I was getting more stressed. The patients were getting more stressed. Then I ended up not being as nice as I'd originally intended and getting stressed, and things would just spiral out of control. To keep on time, it takes a bit of focus. It takes a bit of concentration. It's harder work. It's lazy to just let the consultation just drift on and on and on. So what I've learned is it's perfectly possible to be nice and efficient. The most important thing, of course, is listening to that patient's opening narrative, where they always give you virtually all of the crucial information. All those ideas, concerns, and expectations are often gift wrapped in that opening narrative for you. And it's listening to that which is the really crucial thing. And 90% of the time, the patient has told you that within 2 minutes, giving you plenty of time to explore the rest of the consultation. And so it's perfectly possible, tip number 1, to be nice and efficient at the same time, but it takes a bit of focus, it takes a bit of practice. My second top tip is you do not always have to do something. So when I first started in general practice, patients would come and see me about this pain that they had. Often it was completely unexplainable type of pain, or they'd seen hundreds of other doctors with this type of pain before. No one had succeeded before as well. And I always felt that I had to try to get to the bottom of it for them, that I had to try to investigate it or give them another type of painkiller, etc. And then I realized that that's not always the case. You do not always have to do something. A really crucial part of being the GP or a clinician is actually bearing witness. It's a universal human need to share some sort of suffering. So when you're suffering with a symptom of pain, you have a need to tell your partner, your friend, your parents, your children, whoever is in your life about that, and to have it acknowledged, to have it validated. We seek reassurance as human beings, and that's a really important role that the clinician takes, is listening and absorbing and bearing witness, particularly people that are lonely. And when I say people that are lonely, I do not mean people that live on their own. Often people that live on their own are not lonely at all. They've got loads of friends, whereas you can get people that have been in very long marriages or in very busy, full households that feel tremendously lonely because nobody ever listens to them. So never underestimate the therapeutic effect of listening, and just bearing witness to a symptom is often all that is really needed. And then offering that sort of, reassurance, expressing your empathy, that can be very, very powerful and very, very therapeutic. Thirdly, one of the most fascinating things about being GP is I think it's the purest form of doctoring. When you're working in hospital, you're surrounded by other white coats. You've got a CT scanner in the next room. You've got an endless array of blood tests. When it's you and your patient in the consulting room, you've just got your head and your heart to sort of go on. It's pure doctoring. You've just got to rely on your clinical acumen, your judgment and skill. And when you first start, that can be a little bit of a scary place. So you've always got to have a very low threshold for asking colleagues for sort of help and advice. But as your career develops, it actually becomes a very exciting place to work and to operate, because what separates doctors apart from other clinicians is our diagnostic skills, our diagnostic ability. And that's something which you have developed through years and years of training and is a really important part of who you are. And when it comes to diagnosis, it's really important to just always keep an open mind, not always to accept the groupthink. So when you see that patient on your call list, or the patient coming in to see you with a cough, they've had 3 or 4 chest infections before, it's very easy to get into the groupthink of, recurrent chest infections, another amoxicillin. But to think a little bit out of the box, to think, well, why is this patient having these recurrent chest infections? Could they have some underlying heart failure? Have they been checked to see if they've got possible COPD? Could they have lung cancer, for example? The patient on your call list that's got recurrent boils, or why do they keep getting recurrent boils? Have they had their blood sugar checked? Could they actually have hidradenitis suppurativa causing this? So always keeping an open mind, challenging the sort of groupthink, seeing how things evolve over time, and remembering that a really crucial part of your role is as a diagnostician will obviously be really good for the patient, because then you're the one who's likely to make the correct diagnosis. But it's also really good for you, because it is hugely rewarding when you make that diagnosis that other people have not actually made for the patient that's being tired all the time and feeling faint. You're the one that then notices, actually, they've got a low sodium level. Should they be checked for Addison's disease, etc.? It makes your job then tremendously much more rewarding. My 4th tip is to make sure throughout the day you get regular breaks. This is just a survival hack. In between each 10-minute consultation, you need to prepare yourself for the next patient. It's what years ago Roger Neighbor, a consultation guru, called housekeeping. I think that's a bit of a stupid phrase for it, but I think it's a bit of self-care in between the consultations. Even if it's just a 30-second or sort of 1-minute breathing exercise or break. So learning how to do those sorts of slow breathing exercises, breathing in triangles, as it's sometimes called, having a sort of 1-minute mindfulness break, just a quick sort of pause to empty your mind between one patient and the next. And then also to keep moving throughout the day, to keep yourself on the move. Because you remember those fantastic functional MRI images when people sort of move around, the blood flow to their brain then starts to sort of increase. I always keep something like a sort of kettlebell or a sort of dumbbell or something like that underneath the desk. So throughout the morning when you're there, just taking a sort of 2-minute break to just sort of lift some weights or move up and down or get some blood pumping around really, really helps to keep you refreshed and on the ball. Plus, of course, tea and biscuits, lots of tea and biscuits throughout the day as well. And my final tip is the importance of kindness. Just remembering to be kind at all times, even if you don't feel it. Sometimes you can go into work in a foul mood, but you've got to fake it to make it. And the impact of positive psychology is really powerful. So even if you don't feel like smiling, if you smile at people, then they smile back and then you feel better. You start to get a bit of an endorphin rush. So as soon as you get into work in the morning, if you're saying hello to the staff, to the reception staff, you're being kind to them, you're asking them about their lives, your whole working life will just be better. It will just be better. And similarly with patients, just being sort of kind to patients. As I said, it's perfectly possible to do that and be efficient as well. With colleagues, just taking a minute or two to sort of, ask them how they are about their day. And above all, Also, being kind to yourself. It is really important that you regularly check in with how you're feeling emotionally, and that you be kind to yourself. It is not possible to always be the sort of doctor that you want to be all of the time, and that's okay. We're human. That is humanity after all. We are all like that. That is absolutely perfectly fine. But you've got to learn to be kind to yourself and understand that with patients and with clinical medicine, sometimes we will make mistakes. That's okay. Sometimes patients will make complaints. Again, that is okay. You cannot please all of the people all the time. But if you're kind, and if you listen, and if you keep an open mind about diagnosis, and if you pay really close attention to self-care, then a really, really rewarding, long and fulfilling career awaits you. Thank you, and good luck.